All right.
It's been there forever.
Welcome back from our lunch break. We are going to go ahead and move on to our 6.6 item, Lake County Health Services Bi-Monthly Update. With that, we will invite Director Portney and Dr. Sporer up. So,
good morning, board. Good morning, community. Before I pass the microphone to Dr. Sporer to give a general health update for the county, I just wanted to provide a couple updates for the department. So we have a couple promotions and a new hire. We have a provisional director of nursing, Philip Wegner. Two promotions in our department are our new deputy of public health, Aisha Miller, and our new deputy of health services, Randy Grafton. One thing that you should be excited about is on Friday, the leadership team is going to meet, and we're going to, with these new hires, establish a new org chart and chain of command so we have a great system flow for our department. And the reason why we're needing to do this is because we have two new open positions and recruits that are closing here soon that we've got ample great candidates for, and that's our health equity coordinator and our epidemiologist, which we're really excited about. Outside of that, some pending developments and contracts. WellPath, thank you County Council for supporting the process for jail medical and getting that done. Spoke with David this morning, who facilitates jail medical, and their leadership team is signing the contract, and they're going to be hopefully delivering that to us by the end of the day to present to you. And our Blue Zone, our collaboration with Blue Zone is growing at a nice rate, looking at tobacco policy discussions within the county, looking at tobacco retail licenses, and how we can potentially reduce morbidity and mortality by looking at how we're monitoring, tracking, and allowing access to tobacco products in the county. And with that, and if there are no other questions, I would like to allow Dr. Sporer to give a further public health update on current events.
all right.
Thank you, Jonathan. Thank you, Board, for letting me be here today. I was here 2 months ago saying how nice everything was, but now it's not so nice. We've seen a sort of a triple epidemic coming up upon our community. We're holding our own at the two hospitals, but what you've heard about nationally is the RSV, the respiratory syncytial virus, which is getting, I'm sorry?
Oh, no, it's someone.
Respiratory syncytial virus, which is causing a lot of pediatric hospitalizations. All our pediatric hospitals are packed across the country at this moment, and everybody's working overtime. Fortunately, at our hospitals, I met with them. We meet with them every 2 weeks to see how they're doing with the RSV. And so far, they've only had 1 or 2 patients who needed to be transported out, and they were able to find rooms for them. So it hasn't impacted our community at this point. We think we're probably going to peak in the next couple of weeks with RSV and then start to go down. In addition to that, we also have probably one of the worst flu seasons we've had in 15 years or so. So we recommend people to get their flu vaccinations if they can't. That's causing about a 25% increase in admission rates across adult hospitals. So we're going to see some strain here as we get into the new year. At the same time, we're starting to see about a 10-15% rise in COVID and coronavirus across the country. We're seeing more people getting admitted. So we worry about having the two flus and COVID at the same time, causing hospitalizations to go up. I don't think it's going to be New York City 3 years ago, but I think it'll be a tough winter to get through, as we've had them commonly, and we'll work with the hospitals here to get through this. Hospitals are generally, we've been working with the state. Several things are happening. The COVID state of emergency is ending at the end of February. They're gearing up for flu, Tamiflu, other things are available for our patients who need it, and working with trying to help with the transport of patients from one place to the other, which is one thing we need a lot in Lake County. So get your vaccines if you can, please. I got mine. It was pretty easy at Walgreens. So I'd be happy to take any questions.
Supervisor Pyska?
So
In the past, we've had trouble when people on the weekends get sick or need their doctors, and a lot of our doctors in county don't have on-call
Yes.
physicians, which is something I got to experience again last weekend. And it's really frustrating, but Adventist is opening a clinic, the urgent care clinic, the second week in January, which is the one and only urgent care clinic that we're going to have in county. And I think that's going to be really helpful for those, I don't know about you, but everybody in my family gets sick on Friday afternoon. And we're always directed to go to the ER, and that's not a good situation. So it is something that we've spoken with Director Portney about, is having urgent care in the county. I'm really excited. Can't wait for it to get here soon enough. I think do you know the date? January 8th or 9th, I think.
The New Year's.
And it's the second week, I remember that, because I was delirious when I got the news. So I just wanted everybody to be aware of that. And then also, if you could give some guidance when people are sick and they don't know if it's the flu or if it's COVID, or, kind of what to do and how to tell the difference. If you have any input for the public on that, that'd be really helpful.
Okay, I think we have something we could share.
Okay.
Supervisor Green, and then Supervisor Sabatier afterwards.
Yeah, maybe more for Director Portney, but I'm glad that in general our pharmacies have some supply of vaccines, but sometimes standing in line and getting all that done, people can come in with the best of intentions and then wander out before they get their shot, myself included. So it's been very helpful, at least for the clinics we've been having for the COVID-19 boosters here, even though I know attendance is spotty. Do we have any capacity? What's our current vaccine supply, and is there any capacity that we could stand up clinics, at least for county employees? I mean, we are disaster workers. We want to stay resilient, but, is there any, other than pharmacy supplies and whatever you can glom out of your family doctor, what can we do to stand up broader access to flu vaccines?
Yes, so Supervisor Green, we have a partnership with drawing a blank on their name. Optum, yes, OptumServe.
OptumServe.
Who provides vaccines for the county. And usually when we have extra vaccine or reserve vaccine, we send a county-wide email to let them know how many vaccines we have, and then we invite them to the health department to reserve those. And we will continue as long as the state allows us to leverage Optum to continue to provide that service. For example, on Mondays, we actually have a van that does testing and treatment at the Lake County Health Department. So residents are more than welcome to come by on Mondays to access those services and get connected. They're also welcome to call the health department to see when we have extra vaccines available, and we can set up time for them when we have reserved to be able to do that.
Thank you.
As well as leveraging our pharmacy, CVS, and our other partners.
All right. Supervisor Sabatier?
Yeah, just curious, you spoke about the RSV and the flu and COVID. You did mention a little bit about our local hospitals, but as far as their capacity, they're able to handle exactly what's happening right now, other than obviously the higher level of care needs to be transported out of county.
Right, we're seeing there a little bit of an increase in the transports out and the facility transports, but not huge. They're able to handle what they have. Our ICU capacity is about 8 beds. We have 2 empty right now. So we're handling it at this point.
Thank you.
All right. Any other questions from the board? Open it up to public input here at this time. It looks like we have someone in chamber, so if you'd like to come up to the microphone and state your name for the record, we'll start your 3 minutes.
Joan Moss, journalist. I want you all to know that according to the press, Dr. Fauci has given a deposition, and our president and Dr. Fauci are being sued by 2 states, the state of Missouri and the state of Louisiana. and they are giving depositions presently over the misinformation and censorship by the media. So there's two sides to every story, and I'm sorry, but I'm here to give you the other side. Thank you.
Thank you, Joan. All right, is there everyone else in the chambers that would like to speak on this item? If not, I'll go to Zoom. I don't see any hands up in Zoom as of now. All right, so I'll close public input and bring it back to the board. It looks like we have it's just a report, so there's no other questions. Thank you for the report, and we'll see you at the next update. All right.